Well, young people's health really matters because young people are a key moment in time. It's when people transition from being children to being adults, and they set up their entire adulthood really and their adult health behaviours.
They're tomorrow's leaders, teachers, medical researchers, innovators. So their health is of critical importance.
Everybody should be living a healthy life, and with young people they're particularly vulnerable to poor health outcomes because they're at a point in their life where there's a lot of transition and change, and that opens them up to particular risks.
So adolescence gives us this really powerful opportunity to intervene early and optimise healthy later life.
So what we're doing at Burnet is trying to monitor chlamydia in that population and work out ways that we might be able to target them for increased diagnosis or increased prevention.
I work in the Young People's Health team, and the main project that I work on is the Sex, Drugs and Rock and Roll study. The survey's been going since 2005, and each year we recruit around 1,000 young people, and we ask them lots of personal questions about their sexual health, alcohol and other drug use, and also their mental health as well. And we sort of monitor how those answers are changing over time. That's important because the information that we find out from young people can help us to develop new programs, new policies, and really provide us with an update of what's going on in young people's lives.
As a virologist, I immediately think of adolescent girls and young women in sub-Saharan Africa who bear the brunt of the HIV epidemic. The question that we've been asking over the last 7 years is why the optimal vaginal microbiota help protect women, young women against HIV. And we've been looking at a particular molecule that these optimal bacteria produce. The fundamental knowledge that we gain by studying that molecule, we hope to exploit that into developing a novel way to prevent HIV transmission in these women.
Some of the topics that I'm researching at the moment include the impact of pornography, the role of sexting, how Instagram is affecting body image, and how social media is affecting well-being and mental health. These are all areas that we really have very little idea about, but it's clearly going to play a big role in young people's lives because they do spend so much of their lives on social media and online. There's no way that it's not influencing them at all.
It's easy for governments to make assumptions about our youth population are doing okay because they don't have any data to prove them otherwise. So our research has been really critical in being able to quantify, to identify the preventable burden of poor health that young people are experiencing, and therefore to make them more visible, therefore to start the conversations around how we need to respond.